my name is Chrissie Hodges at treatmentforocd.com. Today I want to talk a little bit about the most effective therapists that can treat OCD. Not all therapists are trained to treat OCD effectively. You want someone that's specialized, someone that understands best practices and evidence-based therapy that will help you to learn how to manage the symptoms of OCD. This is in the form of cognitive behavioral therapy, but in particular, exposure response prevention, abbreviated ERP. Now, you would think that any therapist would understand that if there's one particular type of therapy to use, that they would use that and help people that come to them with OCD, but this just isn't the case, unfortunately. And there are a few reasons why this is. It isn't because the therapist wants to do you harm. It isn't because the therapist is stupid or ignorant. It's just that a lot of therapists are treating a lot of different illnesses and they may not know the best practices when it comes to an illness like OCD. It's important when you go to a therapist to make sure they are using exposure response prevention. I would probably also ask if they can point you in the direction of success stories. Maybe they have some on their web. Maybe if there's HIPAA compliance, that you could talk to someone who is treated successfully. You want to know that they are an expert in the field of treating OCD. So you may think, well, I've been to a therapist and we've been doing talk therapy or we've been doing EMDR or other things and it's really not helping and it's making me really upset. I've wasted a lot of time and I've wasted a lot of money. Why would therapists say that they treat OCD when they don't? A big part of that is just lack of knowledge of best practices for OCD. Again, this is just not being exposed to specialized treatment for OCD. This also may be because they've treated people in the past that have OCD. So someone may come in and they may use thought stopping or they may use these techniques that seemingly work, but for the long run they don't. And they stop seeing this patient and they may just think to themselves, well, I successfully treated them. So moving forward, they'll use those techniques again on people with OCD, but it just isn't effective. While some of these things may work in the short term, if you're not getting evidence-based treatment like exposure response prevention, it is probably not possible that you're going to be able to manage the symptoms effectively long term and go into recovery for OCD. Now, another part is just ignorance. And I don't mean that therapists are ignorant. The therapists went into the field to help people feel better. But if someone isn't just up to date on the latest research for things like OCD, they really just may not know what works, and that really isn't their fault. Luckily, you've come here to treatmentforocd.com. My name is Chrissie. I can help you with a consultation or a peer support session to find out what you've been through and help point you in the direction of a therapist that may be in your area or that you may be able to access via phone or Skype. Most therapists can do teletherapy that's HIPAA compliant. And just so you know, Skype therapy is just as effective as in-person therapy if there isn't a therapist in your area. So check out the website. If you want to do a consultation for referrals only, you can click on that link, or we can go to a peer support session and we can talk a little bit more in depth and maybe some of the fears that you might have leading up to treatment, and I can help support you through my own lived experience with OCD and being able to move you forward with some hope that it is possible for anyone to live in recovery with OCD. You just have to make sure that you have the right therapist. Let me help you find that right therapist and get on your own path to recovery from OCD. Thanks. I'll see you soon.